Hi everyone, I'm Maru Quintero with NC Counts Collation. Welcome to Shine a Light, or Voces que Iluminan in Spanish. We are excited to share this space with you, a place where each month, one of our members share their story, highlights their work, and tells how the census support their efforts. Our guest for today comes from Region 2, which is a triad area, and they're based in Winston-Salem. Correll, we are so glad to have you here. Please introduce yourself and the name of the organization.
Absolutely. So thank you, Maru, for having me. Again, my name is Correll McCrae, and I'm the executive director and special advisor to the board for the 20 here in Winston-Salem.
Perfect, perfect. So let's begin to know more about your organization. So, what inspired the creation of your organization, and how has a mission evolved to meet your community needs? How does it come?
Absolutely. So the thought behind the 20 was developed a few years back. We are a board of working directors. And so one of the things that we really focus on is listening to the community. And so that's really how we put our minds together. It was really about seeing and listening, leaning into the community. And so our work spans mental health, food access, and it really got our foot into the community during the COVID-19 pandemic with the support and help of NC Counts. And so a lot of our work has like transitioned and bloomed into something that we did not know would be here today. And so we would just it really just came down to listening to the community. And so now we're involved in workforce development as well. So just really looking at the needs and where how we can close the gap and help disparities in a different kind of way.
So, talking about the needs, how, based on the role, because you are the ED, right?
Mhm.
How do you help uplifting the voices, the strength, and the story of the community that you serve?
Uh,
Because there are so many things happening. So,
yeah.
how did you get everything together and, hey, this is what we need to do?
Yeah, absolutely. So again, I'll just go back to listening. One of the things that we're actually able to do now is get involved in youth entrepreneurship as well. And so again, there's a need there trying to close the gap with everything increasing. And so families are looking for ways to make more money and then improve their skill sets. And so we roll up our sleeves and help them on that path in terms of entrepreneurship and really focusing on with the children and getting involved in our middle and high schools in that way. One of the things that we also do is partner with our local newspaper. We know that a lot of our audiences still rely on newspapers, so we partner with the newspaper, the Chronicle here in Winston-Salem, which is primarily focuses on the Black community as well as I think it's called K-Pasa. I think that's we work with. Yep, we work with them as well to get information into the community. And so, what we really focus on the information that we push into the communities is that health, what education really about the resources in their area that can help them make or informed decisions or be a resource, whether it's food, employment, access to I don't know, just whatever the needs may be. We are really in the community, just trying to coordinate needs, and so the community looks at us as like a coordinator, a hub of that kind of information, just really guiding people to the right resources. We might not be the person or the entity doing the programming, but we often are able to connect you to the right resource and program that can meet you where you are.
So, talking about listening the community, you just said that you not necessarily are the primary contact to, offer the programs, but
Mhm.
when you are listening to the community, do you have listening sessions, you as 20s, or
Oh
you
yeah.
support in another CBOs?
We kind of do both and so we don't really have like a listening session per se, but often we get involved with other CBOs who's addressing said disparity again, whether it's food access, Right now, we're working with Triad Restorative Justice. This summer, wrapping up our summer STARS project. Uh, and that had everything to do with addressing youth mental health in a roundabout way to kind of have an impact to improve their relationship with the school system and with the justice system. And so, again, just trying to support CBOs where we feel like their mission aligns with our mission. And that's pretty easy with the 20. If we want to work together, we want to work with communities. If we can see that there's going to be impact and benefit to how, especially it's uplifting young people. We have a real keen focus on engaging young people and their caregivers. We feel like post COVID, with youth mental health rates going up in the direction that they're going, we recognize that there needs to be more support around CBOs as well as the Winston-Salem Forsyth County school system, whom we also partnered with during the COVID, the opioid response in terms of training some of the Winston-Salem Forsyth County personnel on mental health first aid. And so really just trying to do those kinds of things and close the gaps where we can and just to inform and empower the community, especially those that are looking after our young ones every day.
So definitely becoming a trusted messenger.
Yep.
So when hopefully we don't get another pandemic, but we are having a lot of endemic situations. So you're ready. You're always ready because
Yep.
people believe in you.
Yep.
I
And I
believe.
would say the readiness just really comes from uh, just being in the community and just being listening. And so it's really the more we are able to listen, we know we are able to say, how have you tried this organization, or are you aware of this particular resource? I mean, oftentimes the answer is no, because they have other stressors going on, right? And so we have to check our own privilege because we are in this work every day and we know the resources, we know the people. We can't always assume that because someone lives here that they know that resource as well. And so just really being a listener and to their conversations, and that's really how the magic happens.
Agree. Connecting dots, that's where
Mm.
the magic happens.
Mhm, mhm.
And you say something very interesting because no, because we live in a city or in a county, we are aware about all the systems or
Yep,
programs we have. That's
yep,
true.
yep,
That's
yep.
interesting. You mentioned Forsyth and you're based in Winston. That's the only county where you are right now.
Well, so yeah, so we're based in Winston-Salem, but one of the things that we do, we try to work, we have worked and do work across the state when opportunities present themselves. So one of the things during COVID, we were in, I want to say about 25 counties, supporting vaccine operations. And so really crowd control, helping with registration, uh, tents. We provided a lot of tents for a lot of vaccination events. And so again, just doing our bit where we can, whenever we can. Uh, we partnered with, I think, about three of the states vendors during that time, and I think it could have been a lot, a few more, because things kind of got hairy by the time. But but yes, most of our work is based in Winston Salem. But whenever there's an opportunity, uh, say for instance, Dr. Powell has something going on, or has a colleague over in Region 4, or there's a need in Region 1 where we can kind of share resources in terms of manpower. That's one of the things that we provide, and we also provide those door knockers. And so we're in the community knocking on the door and say, "Hey, did you know?" And oftentimes they don't know. And so you asked about the lifting up the voices. And so it's really not just the voices of the community, but also the voices of our county commissioners, who we work well with, our county leaders in terms of the health department and the social services department, amazing partners to work with, and so many other the police department, sheriff's department. We really work together. So not only lifting up the community's voices, but also lifting up our partners' voices in terms of the services they provide. And oftentimes there's a gap there. And so we do try to close that gap with our street team.
Awesome. Awesome. If we ask you, which is your powerful asset or the most powerful asset that your organization has?
So the people are definitely one of the most powerful assets that we have, and we can't do half the work that we do if we didn't have the people to listen to, as well as the people to the manpower to push the information out and have those educational resources or health resources. So the people are is definitely one of our biggest and best assets.
And we know that in the work that we do, people means something in the census world.
Hmm.
So, how do you utilize the census data to help you understand better your community and the needs that they have?
Absolutely. So one of the things that's really interesting about me is I do wear many hats, and so as you see, I teach at A&T, North Carolina A&T, full time in the Department of Population Health Management and Policy. So
Awesome.
one of the classes that I teach is health policy and the U.S. Healthcare system, and so the way I tie that conversation in with the census is that even though it's not traditionally looked at as a health policy, it is
Mm,
a health policy in terms of counting people and understanding who's in what zip code and where things are. And as we know, and public health teaches us, zip codes do matter. And if we don't count folks, how do we provide the resources, right? And so that's how I kind of tie that conversation in to my everyday world. Shout out to NC Counts for lifting up the census, but then also using the census to make sure that that people are counted, that their voices are being heard. And so it is important. So the work that we are able to do with NC Counts in terms of I would like to call them wraparound services, where we're standing in the gap and closing the gap. Providing those wraparound services helps us stay engaged throughout. So when it is time for the census,
mm.
that trust is there. They know our street team. They want to listen to us. So your work is really important to really help us do the things in the in-between time outside of the census, because that's what engagement is about. And NT Counts provide the resources for us to stay engaged with the community. And so we're very grateful for that relationship and that partnership. It's been very fruitful, um, going way back before COVID.
Well,
So
the
there we go.
grateful goes two ways.
Awesome.
That's for sure.
Absolutely.
That's for sure. So the census data for people who are used to work with that is, I wouldn't say easy, but it's useful, and they
Yeah.
found a way to make to understand what is happening, right?
Mhm.
On the census,
Yeah.
on the census tract, on the zip code. What would you think can make the census easy to understand?
That's a good question. It's a lot of words, and it's thick. As a thick policy, it's heavily. I think one of the things that how I kind of use it to make it easier and digestible is to
Mm,
just kind of walk families through, like to introduce them to the census, just to say, hey, this is what's in it. Again, building that trust is important. Going back to COVID-19, how we were trying to get people vaccinated, right? We were those trusted messengers. And so it's the same thing, especially within our Hispanic communities, with everything that's going on and how the political climate is. We know how sensitive that conversation can be when it comes to being counted and the things that, so we just trying to help them to see what it actually is, and how responding to the census is not going to be a detriment to their family. And we do that but with our street team. And so having a listening session for someone like me who does read the policies, right? And then just educating the trusted messengers about the nuts and bolts, right? About the real facts. And I think you just let the magic happens. Whenever you're the trusted messenger, it doesn't really take long, right? So the trust is there. And again, going back to the wraparound services and the many grants and resources that you provide in the in-between time, that makes our job easier when it comes to doing the census. And so it's all, it's a process. It's just not one thing. And then, oftentimes, folks want to go back and engage communities after the fact, right? Well, after resources, and now it's all of a sudden census time, and you want to come back and engage the families, and things happen, families change, and the trust is broken down. So we don't want to go through that, right? Because we need everybody counted. So we
And,
want to
and
do the things to keep the families engaged.
definitely, and having the census every 10 years,
Yeah.
between those years, it's hard to keep the census kind of alive
Yes.
because people get, oh, we need to count me or my family every 10 years. Why do I need to be engaged with the census on the other years?
Hmm.
And as we're saying, we need to keep them alive to make people understand how valuable the census is.
Yeah.
That's
Yep.
for sure.
Absolutely.
That's for sure.
Absolutely.
And you have picture already kind of how the alliance or the partnership with NC Counts has support your work.
Mm-hmm.
But
Mm-hmm.
use three words to describe the partnership. Only three.
Oh, only three. Oh my goodness. Three words to describe the partnership. I would say it was inclusive for sure. Inclusive partnership. Um, community focused, as well as joy. I would say joy, really, because anytime Region 2 gets together, it is definitely a joyous occasion. And anytime I'm with NC Council, any of the regional planning meetings, I really feel like I'm in a room with like-minded people. So very inclusive environment always. Very community focused and community center, and always bringing joy, and that always makes it a good team to be a part of. So thank you, NC Counts, for that.
No, no, no. As I was saying before, we wouldn't be what we are if we haven't members as you and all the rest that we have. So for us, it's actually a privilege to have members that are so engaging in the community because we are a small team, but we can kind of spread out the information about the importance of the census through the true messages, the trusted messages, which are you. So, I mean, as I was saying before, the gratitude it's in two ways. That's for sure. Now, I have a closing reflection for you. Is there any message that you would like to share with others who are doing this kind of job that can help your community or their community to be seen, to be heard, or supported?
Absolutely. Just want to remind folks that are in this field and in this work that you can't do everything.
Mm.
Take care of yourself, and also just work with your network. Don't be afraid to reach across the table. Uh, Support goes a long way. And so if I could just say anything, and particularly the climate that we're in, we're going to have to take a deep breath, slow down, and use our connectedness to kind of get through these next few moments. And so that's what I would just say to that. So uh, continue fighting, because we need it. That we are the ones, we are the cavalry at this point, and so yeah, so just also take care of yourself.
Important. One of the things that I think the pandemic taught us is we have to take care of ourselves because when we were in the communities, we are eager to give
Hmm.
away what we have: time, health, and resources. But at the same time, when we get home, it's like, woof, I'm so drained.
Yes.
So I
Yes.
think one of you have repeated that along the conversation, and definitely we have to take care of ourselves in order to serve better the
Hmm.
commit. Definitely. Last message that you would
Yes.
like to say.
One last message. Oh well, so I cannot just have to shout out Dr. Powell, who is amazing in Region 2. She's always ready to support anything that the Tweenie asks for, if there is a way to support. So Thank you, thank you, thank you, thank you, thank you, NC Counts, for the work that you do. The 20 is very appreciative of your work. And we're looking forward to this continued partnership. It's been so great.
Perfect. So thank you so much. Thank you so much, Correll, for being with us today. And it has been a great conversation. We have talked several topics that are key for the work that we do in the state. So, and to you who took the time to watch this, if you haven't subscribed to our channel, please do so. We invite you to be connected, to get activate the notifications and share with others, as well as following us in our social media, because together we are building a healthy, fair, and equitable North Carolina. See you soon.